Hi MicroSport users, this is Vanessa Howe. Today I want to go over lower extremity, meaning the bottom half of our body, setups. Believe it or not, the number one question that we get here at HoweRT is not what program to run, but how to set it up. So I'm hoping that this visual video will help you so that you can feel more confident in your setups. So the first thing we're going to talk about is which electrode to use. Our devices come standard with 2x2s as well as 2x4s. This is really your personal preference. So some people like the smaller size, some people like the bigger. Personally, I kind of tend towards the 2x4s. They stay put a little bit better. One of the trickier parts in the lowers is the hip. So we're going to start there right now. The other option to remember is that you can use towels. So if you choose to use towels, which not a lot of people do at home, you would use these same setups. You would just use wet towels at those places. So we're going to do the 2x4s today. You only need 2 of them. The packages come with 4. You're going to set it up with the red and the yellow and the blue and the green. And I actually intentionally did this where I'm doing the setup so that you guys would see how I do it for myself as opposed to doing it for somebody else. So the red, I always kind of say red goes towards the head. So in general, the red is above and the blue is below. So say I wanted to treat this hip right here. There's a number of different options, and depending on which expert you ask, you might get different answers from different kinds of experts. So I'm going to kind of show you all of them, and then you just figure out which works for you. I personally, when I go to the hip, I like to use the red and the yellow on the low back. So I'm not going to actually set that up, but I just want you to be able to see that it's going to go kind of probably in this area. The other option, I'm going to move my hands here. The other option is that you can move it literally onto the hip, like right where I have this. So you can go from the hip down into the anterior hip. On the front side, if your hip pain is here, you can literally put it on the hip. You can also put it down in general, so that's actually a little easier because it is not going to get in the way. Common question is, how do I treat both hips? Completely okay to actually run from hip to hip. So I might have one on the right hip and one on the blue or on the left. And it does not matter if red is right and blue is left or vice versa. It's going to get there in between. Those are the hip setups that you can use both with the towels as well as the sticky pads. I'm not going to go into a lot of the towels because I know very few of our people use towels at home. It's really more of an activity that you use for clinics, and most of us in clinics kind of understand where to put these things. So that's for the hip. Next, we'll go into the knee. So the knee setups are a good example of where we can start to think about why we are treating and where we are treating. So most of the time when we're treating the knee, we want to treat something internal to the knee. So that really gives us a lot of options. So in general, the current flows from the red-yellow electrode wire to the blue-green electrode wire, right? So if we run it from, say, the quad upper here to here, it's going to be mostly on this anterior aspect. So when we're trying to go through the knee, we often recommend using one on the top and one below. So red towards the head still, the blue below. This can be on the front, this can be on the back. In a similar fashion, you can go this one on the back and this one on the front. Another option that is really great for knees is to go side to side. So you put one on the one side and one on the other. Again, just like the hips, it doesn't matter if one is to the right or one is to the left. This is going to give you a really concentrated current right through the knee. And as I had said before, it is possible that you can also use the small ones as well, so that you can have one on each side. Sometimes people have issues with them falling off around the knee because the knee is pretty active, especially if you're going to use it and walk around with it. This is where I find it helpful to take and string it through your clothing. So you'd actually bring it up or down through the pants so that you're coming out through here, and then your pants actually help hold that next to the knee or to the body part. You can get very creative. You can go side to side here, side to side here. The whole point is that it's going through that knee. Years ago, our wonderful manufacturer had developed these piggyback wires that allow us to take what was 2 pins and make it into one. And it's a very valid question. I get people who say, well, you know, should I blanket the area around the knee with 2 on the bottom and 2 on the top? You technically can do that. However, we've really not seen any negative effects with just using 2. And so it seems to us that that makes it a little bit more complicated without a lot of improvements or better outcomes. So that is the knee. So the ankle does garnish a lot of questions. We get a lot of questions on how to hook up the ankle. Again, it is really just above and below the joint. But I will, just because of the way that sprains and injuries tend to happen, I will kind of show you a little bit more. In general, and this is what it shows in your manual, you can go above the joint and below. I do try to go so that I'm going through the joint. So if I'm on the front, I try to go on the bottom. If I'm on the front of the foot, I try to go on the back here. A lot of times injuries around the ankle involve one side as opposed to the other. So it's really a good idea to be able to, so say you have a, say you have a fibular fracture right here, which is actually not an uncommon injury. So you might actually want to put the red and yellow more on that side, and then also the blue and the green down below. This is also where the small ones are kind of nice because the small one can often fit better on the foot. Socks work great to help hold things in. So place the sticky pads on and then place a towel over it. If you are coming out of, say, a surgery, whether this is the ankle or the knee or anywhere, it's really just above and below the bandages for what makes sense. Even for like ankle or foot surgeries, they will leave the toes exposed. So a lot of times you might really only be able to get, say, on the actual toes. That's fine. Just put it there and kind of leave it there. These sticky pads we have are very hypoallergenic, so they're usually safe to keep on for a number of days for things like post-surgical care. The other option for the feet is that you can use towels. This is actually where I kind of do like towels because it's a nice way to wrap around the foot. And you can intermix it. So you can put a towel here on the foot, but you can also use a sticky pad up above. So you'd put the red, yellow above here, and then put the blue, green into a clip. Most people nowadays purchase the Getting Started bundle. So the Getting Started bundle includes alligator clips, and you just clip it anywhere. This towel is actually dry, but just for demonstration. And that is actually another question as well. A lot of people ask, you know, how wet should wet be? So what we do is we use these little bins here in my clinic, and they should be so that they're like almost dripping wet. So they don't have to be dripping wet, but just so that they have enough so that they're nice and wet. If they're just damp, sometimes it won't conduct well. What will happen is those red lights come on. The newest version of the software actually has an alert. So if the red light flashes, which indicates that it's not getting 100% conduction, it will actually also give you an auditory, a loud little beep. So that is the foot with pads or towels. The feet are actually another great place to do in water. So the feet have such odd structure that sometimes things don't stick. And especially if you're treating, say, both feet at one time, you may want to use a bin. So you fill up this tub with water. The water has to be, you know, above where you want to treat it. So it doesn't have to be that much. So it's similar to the bathtub technique. You do not need to have anything stuck to the pins. They're just the blank pins. So place the blue-green, on one side and the red-yellow on the other. And as long as they're in the water, that conducts throughout the entire water. So this is a great way to treat both feet. We do not recommend adding things like Epsom salts in it because those can actually break down the metal of the pins, but just plain tap water is perfectly fine. You can have it warm, you can have it cold, whichever you would like, and that's how you do it in a tub. The other circumstance that we might have to use microcurrent on your leg is if you had something like a bruise. So this is going to be my bruise. This is my little kinesio tape bruise, but this could also be another kind of issue that you might want to treat. So maybe it's a spot of eczema or a rash of poison ivy, but just it's a local issue that we want to treat. So in general, we're going to use anywhere, whether it's on the leg or anywhere else, we use above and below. So again, choose whichever size you want. I'm going to choose the 2x4s because I've already said those are my personal favorites. So you're going to use the red, yellow above and the blue, green below. The thing with issues, because sometimes these might be kind of small, I like to ideally put at least 3 to 4 inches between the positives and the negatives. So just go ahead and use above and below that, and you can use the larger or the smaller versions. We hope that helps you feel more confident in your setups with your HoweRT MicroSports. If you ever have questions, do not hesitate to ask us. We're here, email, phone, or even texts. We're here to help support you. Have a great day and happy microsporting.